Good afternoon, and welcome to Improving EPSDT Services for Adolescents and Young Adults. My name is Shelley Montgomery Barth, and I am the Youth and Young Adult Health Program Manager in the Maternal and Child Health Unit at the Wyoming Department of Health. I am also the team lead for the Adolescent and Young Adult Health Collaborative Improvement and Innovation Network team that is bringing you this mini grant application. I'd like to welcome you all to the webinar and thank you for joining us today. Just a few housekeeping things. This webinar will be recorded so that we can send this out to folks that were unable to join us today. And also, we will be sending out a frequently asked questions document after the webinar is over based on the questions that come from participants and some questions that team members have identified as well. Before we jump into the webinar, I would like to find out a little bit about who is here with us today. So if you'll take just a minute and look at the poll that you have in front of you, and you will need to scroll. There are 2 questions total. So I'll give you all just a minute to please go ahead and answer the polling questions. We may have some folks joining us just by phone as well that may not be able to join the poll with us. We'll give it about 20 more seconds and then we'll close the polling. Excellent, thank you. So I'm going to go ahead and share the results with you. It looks like actually in the Zoom room with us right now, we have representatives from the Department of Health, from the state COIN team, our federal partners and our state partners, and some other folks as well. I'm hoping that our clinic partners that have registered for the webinar are with us on the phone and are able to at least hear the information that we're presenting. All right, so first I'd like to talk a little bit about the partners in the Pilot Clinic Mini Grant Project. The main partners in this project are the Wyoming Department of Health, and there are several different divisions of the Wyoming Department of Health that are working with this project, but it is mainly housed out of the Public Health Division, the Community Health section. We do work closely with Medicaid and Kid Care CHIP on this project as well. Also, our other main partner is the University of Michigan Adolescent Health Initiative, and we will be hearing from them shortly. And then the Adolescent and Young Adult Health National Resource Center, and finally the Maternal and Child Health Bureau, who has both provided funding for this project and also support and technical assistance. So what is the purpose of this project? The first purpose of this project is to increase EPSDT visit rates in Wyoming Medicaid population ages 10 to 20. Our target is actually to increase the well visit rates of all youth and young adults in the state, but we are specifically working with the EPSDT goal because of the ability to measure our success on a frequent basis with the data that we have coming in regularly from Medicaid. It's also a state priority to increase the EPSDT visit rates in the state of Wyoming. Our second goal is to increase the quality of well visits for adolescents and young adults in Wyoming. And this includes making sure that their screenings are complete, that we're following Bright Futures guidelines, and that there's a youth-friendly environment that's assessed not only by professionals, but by youth and young adults themselves, because they are the professionals in their own lives. So why is this important? Well, during the adolescent years and during young adulthood, habits and behaviors related to lifelong health and chronic disease are generally when that starts, is during adolescence and young adult. high quality preventive services can really play an important role in providing the support that young people need to enter adulthood on that healthy footing. And certainly here in the state of Wyoming, where we have such challenges with access to mental health care and such high rates of suicide among our youth, it's extremely important that they have an ongoing relationship with a healthcare provider who knows them well, that can help refer them to services and also follow through to see if they've been able to access those limited services. The more that we are able to connect our young people with providers that they see on a regular basis, the less that they're going to be apt to use things like the emergency room for ongoing care when they need care for things that are not actually emergency issues. I just want to let you know that this was identified as a priority for the state of Wyoming on the 2016 to 2020 Title V Maternal and Child Health State Needs Assessment. The two priorities for the adolescent and young adult population were increasing access to and quality of preventive care for adolescents, and also promoting healthy and safe relationships for adolescents. And I like to tell people that those priorities are extremely well connected, because one of the things that we do screen for in adolescent preventive visits is healthy and safe relationships, and help to provide young people information so that they can make better choices about healthy and safe relationships. So I mentioned earlier that we were a part of a collaborative improvement and innovation network, and we throw the word COIN around a lot. And so I wanted to give you a definition of what a COIN is. A COIN is a team of self-motivated people with a collective vision enabled by technology to achieve a common goal by sharing ideas, information, and work. Wyoming is one of 5 states that are participating in a current national COIN, and this national COIN is all about improving the access to and quality of adolescent and young adult well visits. So we are working with a team of folks from around the country, and also we have quality improvement partners and coaches, and so we really have an excellent team of support behind us. We are also the second cohort of states that's gone through this national COIN, so we have excellent lessons learned and resources from the first cohort of states that went through this project as well. Here in Wyoming, we call our team the WYA COIN, which is the Wyoming Adolescent and Young Adult Health Collaborative Improvement and Innovation Network. And our COIN is made up of a fantastic group of individuals. We've got maternal and child health staff, we have youth, young adults, physicians, a nurse practitioner, Medicaid, Kid Care Chip, Optum, who is the fiscal agent for Medicaid, and we also have some folks that represent our navigators into the marketplace. And so we really have a fantastic team of individuals that are working hard to try to improve these services for youth and young adults in Wyoming. So you're certainly not out there alone. So what is Wyoming's plan? We are hoping to bring on 8 pilot clinics to start. Our goal is to shoot for 4 pediatric and 4 primary care clinics. Included in those primary care clinics are federally qualified healthcare centers, or FQHCs. This is just about a 3-year-long project that we're looking at. We're looking at bringing on 4 clinics at a time for cohort 1 to be the active cohort, and then they will stick around with us for 18 months and just collect patient satisfaction surveys to help us determine if the quality improvement changes that were made previously in the clinic are continuing to meet the goals and the needs of the clinic as we set out at the beginning of the project. And then the second cohort, those clinics will stay with us for the beginning 18 months and just collect patient satisfaction surveys as kind of a control group. And then after that initial 18 months, we will work with you on the quality improvement efforts as well. We will be providing quality improvement support to improve the rate and the quality of well visits for both youth and young adults. And when you've completed the project satisfactorily and your clinic has met some youth-friendly clinic specific benchmarks, then you will be listed on the Wyoming Department of Health website as a youth-friendly clinic so that young people in your community know where they can go for people who understand them and their rights to consent and confidentiality and how to take care of them in a clinic environment. So let me tell you a little bit about our quality improvement partner who we're going to hear from next. The University of Michigan Adolescent Health Initiative first caught my attention a couple of years ago at the Society for Adolescent Health and Medicine meeting, where they received a very impressive award for the work that they've done around their quality improvement projects for adolescents and young adults in the clinical setting. And on this next page, I'm going to just show you a few of the awards that they've won here over the last couple of years, specifically for the work that we are bringing in, or the type of work that we're bringing into Wyoming at this time. It's one of the reasons that University of Michigan was a clear choice in partnering, and they will talk a lot more about the success of the program. So at this time, I would like to go ahead and introduce Lauren Ranelli and Ellen Wagner from University of Michigan's Adolescent Health Initiative.
Hi, everyone. Give us just 1 second. We're going to do the screen share swap here. You can see our slides now. Okay, great. I think we are good to go. Shelley, can you see our screen?
Absolutely. I can see you great.
Okay, great. So hi, this is Lauren Ranelli, and I'm the director of the Adolescent Health Initiative, and I'm here with Ellen Wagner, who's our program director. Hello. And we're going to talk to you a little bit today about our adolescent-centered environment process, but I wanted to start with just giving you some more information about AHI in general. As Shelley mentioned, we are based out of the University of Michigan, but as you can see from this map, we work with healthcare providers and health systems and state health departments and youth-serving organizations across the country, all towards the goal of improving adolescent-centered care and adolescent health outcomes. So I want to talk to you a little bit today about some of the resources that AHI has available to you regardless of the funding opportunity, just so you know what's out there. And Ellen's going to talk more specifically about our adolescent-centered environment assessment process, which is that first sort of bullet point on your screen. But if you go to our website at some point after this call, I hope you'll check out some of our other information, like our Spark trainings that we've developed. So these are trainings that were developed after we spoke with healthcare providers and health center managers across the country to really get at what are their challenges around providing professional development for their providers and also their health center staff. And we heard consistently that they didn't have a lot of time or a lot of resources to develop training. And so we created a series that we call Spark trainings. And these are 15-minute to 30-minute presentations that can be done in a regularly scheduled staff meeting. They're pre-packaged. They come with a PowerPoint, a script, some case studies, and follow-up activities. They're free to use and just download directly from our site. And they're on anything from adolescent brain development to being an askable adult to adolescent-centered environments and confidentiality best practices. So I hope you'll take a moment and check them out. The starter guides that are on our site are really intended for sites that are starting to get initiatives off the ground. So things like improving immunization rates or well child rates or chlamydia screening. We know that people don't want to dive into a 40-page toolkit, and so we've put together some very brief documents with a lot of resources around what you can do to sort of get something off the ground. Additionally, we have a lot of health center resources that are available to you, including we have posters that were designed by our Teen Advisory Council and videos that can be used for different training purposes, some directed at teens, some directed at parents, some directed at providers, all on various topics like how can teens be advocates for their own health care? How can parents help empower teens during kind of like a transition process where they're becoming savvy consumers of healthcare? We have a great video called Voices of Transgender Adolescents in Healthcare. So a lot of resources that are just on our site, ready to use, available for you, and we hope that you'll take a look. And we do a lot of kind of coaching and consulting and technical assistance with organizations across the country. So if you see a resource and you need some additional assistance, or you don't see a resource that you're looking for, please feel free to reach out to us. All right. So I thought it might be helpful to first kind of ground us in what the meaning of adolescent-centered environment. So the definition that AHI uses is that adolescent-centered environments encompass the policies, practices, services, and physical space of health centers. They are inclusive of, informed by, and responsive to the needs and values of adolescents. And that adolescent-centered environments effectively provide comprehensive services for adolescents, ensuring that they feel welcome ensuring that they feel well cared for. So this is really the goal of the adolescent-centered environment assessment process, is to look at a health center's environment and policies and practices to make sure that adolescents are a valued and welcomed population, and that we're really making improvements towards improving adolescent health outcomes. So Ellen's going to take a little bit of time now to sort of walk you through this process that's available through this RFP.
Thanks. Great. So when we talk about the Adolescent-Centered Environment Assessment process, which we abbreviate to ASAP for short, so you'll see ASAP here through these next few slides, and we're talking about this 18-month process. We kind of talk about it in 3 parts. There's the 3-month planning period, a 12-month implementation period, and a 3-month wrap-up. So I'm going to walk through each of those now. So in the initial 3-month planning period of this ASAP process, you're going to be thinking through who's going to be on your ASAP team and putting that team together and doing some planning around having time for that team to work through the process during the next period. So your ASAP team is going to be people that work at your health center, and it's typically a provider, some type of health center manager, or somebody in a position like that, and then any other committed staff who can dedicate some time to the process. I think the most important thing is to think about people who are excited about this work and wanting to make improvements and being able to be successful. The other thing that's happening during this 3-month planning period is some data collection. As Shelley mentioned, part of this process is doing data collection to sort of look at how things are changing at the beginning and then looking at what happens at the end. So when we talk about data collection, we're talking about 3 key things: staff surveys, provider surveys, and adolescent patient surveys. So we know that by the time we kind of get all those pieces in place, it's going to take about 3 months. Once those items have happened, then we move into the implementation phase of the process, and this is really kind of where the bulk of the project lies. The first thing that happens is that the ASAP team that you put together participates in a baseline self-assessment with an AHI coach helping facilitate the process. So somebody from our team will call in or video in, depending on what works best with your ASAP team, and spend about an hour and a half to 2 hours going through a comprehensive self-assessment that's going to examine 12 key areas of adolescent centeredness. So again, this is a self-assessment. This isn't something that AHI would say, yes or no, you're doing these things, you're not. Your team's really going to know what you're doing best and kind of decide where you are on different items. And then, based on that self-assessment, AHI is going to help you develop a customized implementation plan, which contains resources and workflows and different things that either AHI has created or we know are great resources that other folks have created to help you hone in on some of those items that during the self-assessment you identify as items that you want to work on through the course of the year. So again, you're going to do a self-assessment. Then, based on the self-assessment, your team is going to identify which items from the self-assessment you want to work on throughout the course of the year. And AHI is going to help you develop an implementation plan that you can use to work on those items. Then, throughout the course of that year, you're going to have 3 check-in calls. You're going to have 3 check-in calls with AHI to help highlight successes, identify problems, do some problem solving if there's different sort of barriers you've hit, and then reassess. Maybe there are new improvements that you want to work on at those points. And in addition to that, AHI is going to be available for ongoing technical assistance throughout the course of the project. If 3 technical assistance calls sound good to you, then great. And if you want more than that, then we're always available by email or for a quick call or other types of sort of support or brainstorming that you might need throughout the year. At the end of the year, you're going to do one more assessment using the same assessment tool that you used at the beginning to reevaluate where you now are on these 12 areas of adolescent centeredness. So we're gonna schedule another call that'll go much more quickly than the first call, because at this point your team will be very familiar with the tool and the process. So we'll do one more quick call and we'll go through the tool again, and it's actually really exciting because you're able to say, hey, look at all of these areas that we made improvements on. Then in the final 3 months, which we refer to as the wrap up, we'll do one more round of data collection where we'll again collect those same surveys on staff, provider, and adolescent patients. And then we'll go through a certification process. So sites that work with us through the Adolescent-Centered Environment Assessment process and meet a set of key certification requirements that we've identified based on national guidelines and best practices are eligible for certification from the Adolescent Health Initiative. So we'll take some time at the end of the process to kind of go through and look at your assessment and see whether or not you've been able to achieve the items in certification. And I should say, the first time that you will see these items will not be at the very end of the process. We will share from the very beginning, from the first time that you do your baseline adolescent-centered environment assessment, those requirements. So you'll know the whole time what you're working towards and be able to gauge how close you are to getting there. So that is the ASAP model. And there was just one more component of this project that we want to talk to you about, and Lauren's going to tell you a little bit more about.
Okay, so for sites that are interested, we're also offering a maintenance of certification part 4 as part of this process. So for those of you who aren't familiar with MOC, MOC Part 4 is a board certification on the quality improvement activity that's been established by the American Board of Medical Specialties for physicians and physicians assistants. So physicians are required to do MOC at certain intervals, and AHI has developed an MOC that we've already run with some other cohorts on confidentiality. So for this group in Wyoming, we'll oversee the MOC Part 4 on adolescent confidentiality, giving participating providers a ready-to-use and meaningful experience. So the clinicians who previously participated in this MOC saw significant improvements in well visits that had confidential time alone with the adolescent patient, well visits that included an explanation of minor consent laws, and then finally an increase in use of a standardized confidential risk screening tool. So we have had a lot of really good feedback from providers on the meaningfulness and impact of this MOC. So that's something that we're making available to you as well.
Great.
So with that, we are available to take questions. I think Shelley's going to do a little bit of a wrap up, but happy to answer any questions that people have about the ASAP process or any of the work that we just presented.
I had myself on mute there for a minute. Thank you very much, Ellen and Lauren. I really appreciate you guys jumping back in here or telling us all about the project. One thing that's really important to point out as well is that this is the first project of its kind in the state of Wyoming where we're using a systematic public-private partnership to try to improve not only the access to, but also the quality of well visits for our youth and young adults in our state. And this is important because Wyoming has one of the lowest EPSDT rates in the nation, and we would really like to change that. We don't like to be last at much of anything. So we'd really like to move that forward. It's especially important for our young people. And so we are really looking forward to this pilot process and learning from you and with you as we move forward what might work well for Wyoming practices, especially given our unique rural nature and the way that things are kind of just a little bit different around here. So before we get into the questions and answers, I want to make sure that you all have my contact information. I'm going to go ahead and leave this screen up. We've also had some more participants join us, so I'm going to quickly reopen the poll for just a minute. If you've previously answered the poll, please don't answer it again. But if you have not, it's going to clear all my results. So if everybody would just like to take a minute again to go ahead and vote. We would like to hear what kind of folks we have with us today, where you're from. And I know that when we first did this, we didn't quite have everybody on, so I wanted to go ahead and give you an opportunity. There are 2 questions here, so please scroll down to the second question before you submit your results. And I'll give everybody just another couple of seconds here to get to that. Just over half our votes are in. About 10 more seconds and we'll close the poll if you haven't had an opportunity to vote. Great, thank you. I'm going to go ahead and end the poll. So at this time, what we would do is like to open it up for questions. I'm going to go ahead and unmute everybody's line. I tried to unmute everybody's line and I muted myself instead. I apologize. So I'm going to go ahead and unmute everybody's line and you can go ahead and ask questions freely. If you're going to be making noise again, please go ahead and mute your line at your desk if you think that you've got noisy background. Do we have any questions? Let's see if we've had anybody type anything in chat here.
Hey, Shelley, this is Brenda.
Hi, Brenda.
Hey, so I just wanted to make a couple comments. First off, I wanted to thank you for the presentation today. Very informative. And,
Absolutely.
yeah, and then and you did mention at the beginning when the recording would be available, but I didn't catch that.
So I will send that out later today, along with a frequently asked questions document that we'll be creating from any questions that anyone has.
Okay, good. And then the other thing I just wanted to point out to the folks who are on the phone or joining us is that this application process is really simple, and that I would encourage folks who have an interest in it and want to explore it to go ahead and apply.
Thank you for pointing that out, Brenda. We did try to make this process as simple as possible. And I did have actually one question just come in. And that question was, of course, the financial part of this pilot clinic piece that actually goes to the clinics directly is fairly small. It's about $1,200 at this point in time. We are actually looking for some ways to be able to get you some more money to make some youth-friendly changes in your clinic. And one of the questions that I just had come in is, what are some of the things that you can use that money on? And really, it's any youth-friendly clinic changes that can help your clinic become more friendly for the adolescents and young adults that may come to your clinic. So for example, some people like to have their screening tools on an iPad so that the young people can fill out their screening tools ahead of time, and then that information can go directly to the physician, and the physician then already has an idea of what things that they really need to cover. Purchasing iPads would be one option. Maybe you have a pediatric office and your waiting room is very geared towards younger children, and you want to section off a space in your waiting room and make it more youth friendly. This amount of money will give you some money to be able to, say, buy a divider and some furniture to put in there that's a little bit more youth friendly. Or you may a youth council to help advise your clinic on what's going to be the best practices based on what youth in your community see as what they really need. And so maybe you want to incentivize those youth for participating with food or with gift cards so that they feel like their voice and their contribution is valuable as well, because we know that it is. So those are some of the things that amount of money can be spent on. But it's really those non-monetary pieces that we're really working with our partners to bring to you. And that's the quality improvement, adolescent-centered environment assessment process, the MOC Part 4, and then the potential certification with the University of Michigan, as well as placement on the Wyoming Department of Health website as a place where young people can go and seek out where they can find youth-friendly care in the state. Any questions? Okay, at this time, I'm going to stop my screen share. I want to make sure that I'm not missing anything in the chat. I want to give just another share for anybody that may be working to unmute their phone or able to do that. If there are no other questions at this time, I am going to go ahead and put my contact information back up one more time just to make sure that you have it. And please feel free to reach out to me either by phone or email with any questions that you may have. If there's things that you think maybe we didn't cover in the application or that aren't really clear to you or you think may not fit, give us a call. We're really open to figuring this all out together. This really is a partnership, and we are all learning from each other about how to make our services better and how to get our youth accessing services. One more thing that I may tell you about before we go is that we do have currently out a survey for parents and caregivers in the state, and also a survey for youth and young adults in the state. The Youth and Young Adult Survey was created by youth and young adults for youth and young adults. And those surveys are basically to help us identify the barriers to well visits in the state. So it's really assessing consumers' knowledge of what a well visit is and if they're necessary and if they're covered by insurance and things like that. With the results from that, we are going to be helping to create and provide educational materials for families about well visits to help you be able to communicate that message better as well. So I just wanted to bring that up. The COIN team has more going on than just the pilot clinic project. This is our most important project because working directly with you is the way that we're really going to improve things for our young people. But we do have other really going on as well, and we'll be happy to share more of those with you as we go through this project together. And I'll give it one more opportunity for questions. On behalf of the Wyoming Adolescent and Young Adult Health COIN team, I would like to thank everybody very much for participating today. I would especially like to thank all of the COIN team members that are with us today, the Wyoming providers that took time out of their very busy schedules to join us today, and the University of Michigan Adolescent Health Initiative. And thank you very much for giving us your time and being here today. Have a great weekend, everyone.
Thanks, Shelley.
Thanks, everybody.